Kirenyaga nando akirema kwena meario irario nando aito tugaga ni oge maikaraga makiandikaga tonoti ni mareruta notebook kana ni atia no rendera uga turenda wera turenda kirema kenyitane keherigiji support getha hota kuruta wera na President William Samoei Ruto no kwena ando mararia koria na makavanga na mageciria ate mekwoya giteke rigi githe tutikere na aria makire barotine eri William Samoei Ruto menao William Samoei Ruto menao mena rigiji katiguo na tukimahe wira wa gututongoreria bururi uyu na tukimera miaka 5 yathira ni tukamoria matunda magukiria Wanjiku kuma hari ari nigetha hote kuigirira irio metha-ini ithe tiguo ndi urona ange matari ho nio mambiriirie guikia mahiga tondu matiui agenda cia thirikari ino cia ririku na ndaigua morio kana inywe mwamatumire mukoiga tinywe kwoguo ndirenda kumwira tuhe thirikari ino kamweke na tunyitirire rigiji uyo mutongoria witu ria twinake wena giti kiria kinene thiini wa thirikari ino ungiaria handu-ini ha kirima kuiguika ni uria aroiga
turorete tukona kuna andu mena muirano kithe teguo kuna andu mararora deputy president makona te warikare yake magatuika megutura mathiururukaga makimwagithia gitio kuna mwarenda kuingirira gatagati ya relationship ya deputy president na president ngwenda gukwira atiriri we utuwi ithuwe tutikwenderio ngite kiumba we ni we utuwi na tutikwenda kwenderio ngite kiumba na tutikugura tunaye kwambiria riu nginya muico bau bange njuge ni utuonete maciaro maku umuthi uguku ni wokite guku ringi na ni njui ni utwendete deputy president ithuwe na ni ngugite ithuwe tutitigaga ng'ombe raka tukarumirira mori tone tumenyaga mori ni ciaraga na kathukanyo tukaga kindu tunginyua kithe teguo kwa ithuwe tuguikara nawe niwe tuwi maciaro maku na ni tuwi we ni urakama
na njuge nie ni njugite ndi mutongoria wa kirima ka mwina ungi mwinake guku nie wira wakwa ni kunyitithania andu twaugire mundu wothe wari wa UDA wari wa Jubilee wari wa Azimio angikorwo turaria uguo ndiraria tuhanire turekanire tuikare twe kindu giki giuga nginya Uhuru wa Kenyatta ni mwana witu oke tunyitane hau nega inyuko mundu mwena bara nake ithe githurano getiathirire ithe tota mubira riu tunyitane twe nyumba imwe twendane tondu tungiaga kwendana twage kuiguana tugayukanio no tuone uru ni mukwenda tunyitane ni andu aigana marauga tuikare twe kindu kimwe na ni ura ndamwirire thirikari-ini ino ya William Ruto ni deputy president wira wakwa ni kurora maundu ma andu a Mount Kenya ta iria ririko niguo na ni ndi mwire ndikomaga hingaga ritho rimwe ria ringi raraga rio ni tatoshi nigetha maundu maitu matikae kuhingicana katiguo na kwoguo maundu maria makoretwo magithie na mbere mumenye ni wira wakwa ni kugitira na gutetera nyumba ino itu na ni ngwenda kwira andu a nyumba itu tutikanetikire gukagayanio tondu muthenya tukagayanio ni tukona uru tondu urumwe witu niguo hinya ki urumwe witu niguo hinya ki
Your Excellency, thank you muno ni wira uria uraruta and I want to tell you, just look forward. Don't get distracted by noisemakers. There is a lot that you're given by His Excellency William Samoei Ruto. Na kuna ile kazi umepewa. Maneno kama hiyo ya agriculture, kahawa, majani, maziwa na kila kitu ambaye Murango ni chair kule Senate. These distractors do not want you to perform as you're supposed to so that they get something to pick. Leave us to deal with the noisemakers. Kweli ya urongo?
Kweli jamani, sisi tutaonekana vipi kwa wale watu wengine? Yani watu wameangalia tu, wanaona watu wa mlima wanapigana left, right na center. Mimi naomba kwa heshima sisi wote tushikilie rigiji. Kama kuna wale wanaota, waote, walale na waote tena. Manake ndoto sio mbaya, unaweza kulala, ukaota tena, ukaamka tena, ukaota tena, ama vipi?
Macio mange, Your Excellency, wenyiterera tukirema, acio detractors sisi tutapambana na wao vilivyo. Okorone githongona ninde kiaragia kingi muno andu makirenya ni moe ni mandomithirie akorone gikuyo nakio no njaragia koguo gutire kendo na gutire mundu uguturema ili uweze kufanyia hawa wananchi kazi.
It's moments like these that really do remind us of the profound impact that we can have when we come together in the spirit of collaboration. During our visit, we engaged with leaders of our longtime partners in Kenya. We witnessed tangible results of our collective efforts: healthier communities, stronger health systems, brighter futures. HHS and its operating divisions, all of our family of agencies, really do appreciate our long-standing partnership and remain unwavering in our commitment to supporting Kenya's health initiatives. As you know, HHS, the Department of State, the Department of Defense, USAID, and all of our U.S. government agencies are committed at the highest levels to working together to protect the health and well-being of both Americans and Kenyans. Our shared missions offer countless opportunities for collaboration, and I'm very confident that by joining forces we will continue to achieve great things. As we celebrate our 60th anniversary of the partnership between the United States government and the government of Kenya, we reflect on our joint achievements in health, from controlling infectious diseases to improving maternal and child health and preventing non-communicable diseases. Our cooperation has made significant strides. We also celebrate our successes with initiatives like the United States President's Emergency Plan for AIDS Relief, we lovingly call PEPFAR, the President's Malaria Initiative, and our efforts to continue to advance health systems in Kenya. Today, we commit $31.1 million to power the Kenyan health system with digital data through support for facility and community information systems. And if the minister has her way, she'll take all of our data scientists home with her to add to that 31 million. Additionally, the U.S. government has provided professional development to hundreds of thousands of Kenyans. Moments ago, we launched the Health-Focused Emergency Management Training Program during our tour of the Emergency Operations Center that will build the capacity of public health first responders across Kenya. Finally, we are pleased to announce a twinning relationship between the Kenyan National Public Health Institute and the U.S. CDC, our nation's public health institute. At HHS, we recognize the critical role of global health diplomacy in promoting health security, improving health outcomes, and advancing sustainable development goals. I'm excited about the possibilities that lie ahead, opportunities to deepen our collaboration, leverage our respective strengths, and achieve even greater impact. During this visit, we look forward to a renewed partnership between the Centers for Disease Control and Prevention and the Kenyan Medical Research Institute, or KEMRI.
It's a profound day for us to be here, meeting here to discuss and celebrate the fruits of our collaboration, especially the Ministry of Health with CDC and the United States of America. Your Excellency, this would not have come at a better time than now. As we sit here, the world is now converging to discuss the international health regulations, to discuss the pandemic treaty. And all this is to build consensus for all members around the globe to be able to prevent, to detect, and to respond to public health emergencies. And that is what we have gone through, Your Excellency, at the Emergency Operations Center. So, Your Excellency, as a country, we have taken the steps of the CDC, and we are now establishing our National Public Health Institute, and it's just to ensure that we are able then to be together with the world as they prevent, they detect, and respond. Your Excellency, infectious diseases do not know geographical boundaries. It doesn't matter whether you're in Kenya or you're in America. COVID taught us the lessons. So it is for us as Kenya CDC, and the United States of America people to work together to ensure that in future, should we have future threats, then together we are able to surmount that. CDC, I want to say thank you on behalf of the Ministry of Health for the collaboration with Kenya Medical Research Institute that is represented here with the CEO, Professor Songok. You have worked very well with us to build our capacity through the FELTEP program. You have worked very well with us to build our research and innovations capacity, and we are forever grateful. How do I see the next steps, Your Excellency? We now have a baby, the National Public Health Institute. Our success will be measured on how we collaborate and ensure the National Public Health Institute is able to respond to emergencies as they occur.
Thank you. Welcome. It's our pleasure to be here. We're truly grateful. I with Samantha Hapo. Yes. Thank you. Thank you.
Nice to meet you. Welcome, His Excellency. My name is Dr. Diane, and I work on polio and education, and I'm the president of the Organization of African Public Health Professionals at CDC. Welcome.
Lydia Foreman. I'm working at the Global Health Center.
Thank you very much.
I'm on CDC. I work at the CDC office.
Okay, everyone understands this.
Communicator in the Office of Internal Engagement and Communication.
Needed to strengthen public health programs and effectively respond to health emergencies worldwide. We are grateful for this opportunity to meet you today. Yes.
Boss.
And counties, they can call CDC 24/7 if there's any problem and get in touch with us with a CDC subject matter expert on any topic. A subject matter expert available anytime. So we'll keep walking to the front. So this is the leadership. It's about 230 people. It's not big enough to hold everyone, so we have so in Equatorial provinces where most of the disease is, it's mostly auxiliary with the Ministry of Health to help support, including this measles outbreak in Turkana. We have multiple cases in Colorado.
So the highest was somewhere
10, but yeah,
it went down.
And then it went down, a case of Rift Valley within 7 days. That's the target. Notify public health officials, and then notify. It took a long time to notify because there wasn't testing capability available. But once it was determined it was Rift Valley fever, they responded actually within 5 days. So this is a look at what were some of the bottlenecks in trying to achieve those targets, and what were some of the enablers. So every outbreak, they do a performance review. Our antivirals work and our test work, and they all do so far. So it requires a centralized chain of command. Good job.
Into medical device manufacturing has never been seen before.
Goes between Kenya and the United States, rooted in our history of freedom.
Of both Americans and Kenyans, our shared missions offer. As we celebrate our 60th anniversary of the the Minister has her first responders across Kenya. At HHS, we recognize the critical role of.
Thank you, Your Excellency the President.
Solidarity, recognizing partnerships
Us for all members around the globe to be able to prevent. As a country, we have taken the steps of the CDC and now. As we sit here, the world is now converted. Do not notify for boundaries.
As Kenya's economy continues to grow, disease awareness in the world. We've got malaria stocks available in rapid states throughout the continent. We also want to
jobs, prioritizing female employment, but also putting an emphasis.
My name is Mark Spencer, Director. Thank you so much for having us here today. And the last couple of years has allowed with our comments. I'd firstly like to start and life-saving medical devices on the African continent for the first. Now, during this time, we've managed to ensure that we've been manufacturing. And the know-how that we've had over the past couple of years, and especially after Your Excellency President Ruto,
I was amazed at what is happening here.
A proclamation that celebrates the 45-year partnership. It specifically highlights the Future Partnership Institute. So, Prime Cabinet Secretary guess we gotta get to work.
But with incredible knowledge about these areas. First of all, to comment a little bit about how you're leading the way on primary health care. You have ushered in a set of 4 laws that have dramatically changed the landscape. First of all, by committing to more than 100,000 paid community health promoters, setting an extraordinary standard. It's raised the bar for the entire continent. And you are not only making sure they're paid, you are making sure that they are part of a digital health information system where the electronic records are in their hands. And then furthermore, that they are part of primary care networks that link them to every other level of the health system. They become the outreach to the community and the eyes and ears of the entire system. And that is a process that we are all proud across the U.S. government of being part of. When I visited Kenya last November, out of 315 primary care networks that were established as a goal, there were 47, 26 with support from USAID, CDC, and the Department of Defense. I'm proud to say that now 151 primary care networks have been established, 2/3 of which are with the support of USAID, CDC, and the Department of Defense. Now, our teams are working together to build that capacity. Can't do anything if they don't have the medical supplies and goods that are needed. And you are also leading the future of what our partnership can be with countries across the world for building that capacity. Revital Healthcare is a prime example of what that future looks like. It is a Kenyan company based just outside of Mombasa in Kilifi with a USAID grant of $2.2 million and another $2.2 million in matched funds from Revital itself. The company has built the largest medical diagnostic manufacturing plant in Africa. Africa is home to 94% of the world's malaria cases, but the majority of malaria commodities are imported from elsewhere. And so in the last year, PMI, as the program's called, has doubled its purchasing of African supplies for anti-malarial drugs and treatments. For example, from the Kenyan manufacturer Universal Corporation Limited, and from also another Kenyan manufacturer, Dawa Life Sciences. This also includes work with Revital as it goes through the process to achieve WHO pre-qualification for malaria rapid tests, which will enable them to be candidates for procurement by PMI in the future. These approaches, the commitment all of the connections that have had to be made are nothing short of transformative. Not only are we building health systems to deliver the best quality service possible, but we're supporting industries that can equip those systems. Kenya's leadership is setting the pace. As Kenya's economy continues to grow, we're going to see mutually beneficial skills, technology transfers at the foundation of our relationship.
I just wanted to remark on how thrilled we are to be signing the new Memorandum of Understanding between the CDC and KEMRI today. I think you may know so many important discoveries have come from that partnership. Many WHO recommended interventions have come from that CDC-supported Western Kenya platform, particularly in malaria, the fact that we recommend insecticide-treated bed nets, that came from that work. The clinical trials that we now use to prevent HIV infection for the medicines for before and after high-risk exposure, from that platform. And then the cost-effectiveness work we did around childhood vaccines for pneumonia and the rotavirus, from that platform. So I'm really looking forward to signing this new Memorandum of Understanding, and it ensures we can continue that partnership well into the future. And in particular, I am excited that we are establishing the Kenya Applied Sciences Hub. I think this is going to be a hub that is a cross-agency effort without a specific disease focus, so it can be available to no matter what health threat comes our way in the future. And importantly, it's going to be a regional center for laboratory capacity building, biosafety and security, and diagnostic evaluation. I think you may know CDC has supported the establishment of 3 BSL-3 labs at KEMRI, and this will be the hub of that work. We're going to be working more on malaria, on genetic sequencing, and making sure that we're working on, again, the next generation of the scientific advancement to power the manufacturing you were just hearing about. So thank you for that shared vision of collaboration.
Now, support has always come from partners. Having true key partners is what makes private sector perform at the highest level. Partners such as the government of Kenya, from Your Excellency President Ruto, this has enabled us to give us that confidence to move forward, but also from the likes of the Bill and Melinda Gates Foundation that helped to build the capacity for our 0.5 ml vaccine syringes, that ensured that there is capacity for immunization campaigns across the entire of Africa. That enabled us to increase our capacities to 330 million units of the 0.5 ml vaccine. Now, additionally to that, with USAID coming on board, with the technologies that we're developing, again, this will create even more jobs and even more technologies for Africa for the first time. Now, I want to pledge something which is what Dr. Atul, you have mentioned. Revital promises to have an ERPD and WHO pre-qualified HIV rapid test kit in 2025 to support PEPFAR's initiative for 2025 for local procurement in Africa. Now, even more importantly to that is we're putting a flag, or we're putting Africa on the map, and we're putting Kenya on the map as a technological leader in the manufacturing of medical commodities that are so highly required. We're reducing the burden, or we're reducing our over-reliance on the East, and we're reducing our over-reliance on foreign exports, and now finally locally manufacturing our products, which has been strongly supported by, again, the government of Kenya, as well as our friend here, Professor Songok from KEMRI, to make this a reality here today. Now, as I now conclude, this is not what we want to continue doing at Revital. This is not where we stop. We will always try and push the technology, and we'll always try and do more for Africa and develop healthcare security in Africa through centralized warehouses and pharmaceutical repackaging, where Revital now calls upon us in this room here today to try and bring more US-based technologies and more US-based pharmaceutical companies into Africa for the supplies of generic, of branded medicine, so that there is a complete stoppage in terms of the gap that is currently available in the market.
Three things are very critical and at the center of what Kenya tackles. Health is one. The President has been extremely passionate on that, and he'll speak to it. The other is education, and the other is ensuring that there's food security. These things don't come cheap, particularly health. It's very expensive. It's a big challenge. And as we reflect on the issues that we have been shown today, I think it will be critical to figure out how can we channel more resources to the health sector so that innovation, research, and the ultimate results can be there, knowing that health also requires a lot of patience, research also requires a lot of patience, and therefore it needs more dedication in terms of the commitments that we can make so that there can be a sustained onslaught in ensuring that the health of the global citizens can be taken care of.